Hello everyone, I'm Dr. Shamsundar, radiation oncologist from Precision Oncology Clinic. Today we will discuss about treatment of head and neck cancer. As most of you are aware, for head and neck cancer we have mainly two types of treatment. First is surgery, second is radiotherapy with chemotherapy. So in which patients we use surgery and which patients we use radiotherapy and chemotherapy. Most of the cancers in head and neck, which are in the oral cavity, that is in your lip, tongue, cheeks, that is buccal mucosa, or along the mandible, the preferable treatment is surgery. Here always, if the patient is operable, it is better to go for upfront surgery. Also in advanced neck cases, especially in advanced laryngeal, periform, sinus cases where the patient is not able to swallow properly, here again, we usually offer surgery as the first line of treatment. Post-surgery, depending on the stage of the disease, if it is very early stage, then probably no further treatment will be advised. However, if the stage is a little higher or it's advanced stage, then post-surgery also radiation and plus or minus chemotherapy, depending on the stage, will be offered as treatment. However, in cancers of head and neck, where organ preservation is important, especially if there is a cancer of the larynx or of the hypopharynx, which is mainly related to this part of the body, that is the neck. Here we usually try to have organ preservation because surgery in these areas will cause a lot of morbidity. That is, they will lose the power of speaking, breathing will be difficult, food intake will be difficult. So in this subset of patients, we will offer radiation and chemotherapy as the first line of treatment. So radiation chemotherapy, we offer as first line of treatment in cases of laryngeal cancer, piriform sinus cancer, pharyngeal cancer, nasopharyngeal cancer, and other subsets where surgery is not possible. Here, radiation and chemotherapy is the treatment of choice. So in the end, what I would like to stress upon is, even in head and neck cancer, there are organ preservation strategies, especially with the use of radiation and chemo. However, there are few subsets of cancer where definitely surgery is better. So if you have any doubt, contact the nearest your oncologist for better treatment options in these conditions. Thank you.